I'm Linda Bruck, a registered nurse and director of nursing for Bright Star Care. I'm here to talk to you about several things, the first being National Patient Safety Goals. National Patient Safety Goals related to hospitals would be identifying patients correctly. Patient name and date of birth are usually the two identifiers that they use. Second National Patient Safety Goal is to improve staff communication, and that would be that patients receive accurate information about test results as soon as possible. The third National Patient Safety Goal is use medications safely. And of course, you know that medications need to be delivered safely and administered as directed by the physician. And to take extra care with those patients that have blood thinners as a medication. Use of alarms safely. As you work in a hospital, a lot of machines have alarms that alert you to something's not right. And so if the alarm system is not working, please report that immediately and switch out the equipment. Preventing infections. We all know that good hand washing is the most important way to prevent infection from one person to the next. Hospitals have a 100% goal of hand washing. Everyone washes hands when they enter a room and exit a room, and at appropriate times during treatment. Identify patient safety risk. Find out which patients are likely to commit suicide, and preventing mistakes in surgery. Make sure you have the right patient, the right body part, and all of those safety guidelines that are required in a surgery department. For home care, there are also national patient safety goals, and one is preventing infection and good hand washing. We also like to include good bath hygiene when delivering personal care. A second patient safety goal revolves around oxygen, making sure that there are no candles, no smoking in the home, and make sure that the home is identified that there is oxygen in use. Using medication safely. At the initial assessment of a home care client, the case manager will do a medication reconciliation. CNAs do not administer medications, but they do remind clients to take medications. The last National Patient Safety Goal is to prevent patients from falling. Again, at that initial assessment, the case manager will identify those folks at risk for falling, and then make sure that the plan of care reflects what the direct care staff need to do to help lower the risk of falling. Infection control and hand hygiene. Again, for all staff delivering care to patients or clients, it's extremely important to wash hands, use gloves, and in the home care client binder, you will find a list times when you need to wash hands and change gloves. So please refer to that. Bright Star Care has a safe transfer policy. Our direct care staff and clients are important to us, and as well as their safety. To prevent injury to either, we have a safe transfer policy. Direct care staff cannot lift clients. We have a no lift policy. We certainly can use a gait belt and boost them out of a chair. If the client is unable to stand and transfer without use of a gait belt and there's more lifting by a CNA, we elevate that level of assistance probably with a mechanical lift. And again, if they cannot participate in a sit-to-stand lift, we would even elevate it to a full body lift. Competency regarding safe transfers will occur at your orientation. There will be more clarity regarding that, but know that we have a no lift policy to protect direct care staff and clients or patients from injury. Ethical issues in healthcare and patients' rights. We certainly expect honesty and respect to all clients and staff. We expect compliance with the law and focus on quality. We expect that direct care staff take responsibility for their actions, and we expect that there is responsibility for reporting violations. So if there is an abuse or neglect, we would expect that direct care staff and other professionals report that to the designated authorities. All of our clients and patients have rights and responsibilities. Our clients have the right for care without regard to color, race, ethnic background, age, disability, political or ethical beliefs. Our clients have the right to know who the caregiver is that's going to take care of them. They also have the right to expect that all caregivers have been competencied and can deliver that quality of care. Clients have the right to be free of physical, mental, and emotional abuse and to be treated with consideration and respect. Clients have the right to be admitted to our Bright Star home care and expect that we can deliver the level of assistance that they need. They need to be informed of the plan of care and plan of treatment for them. They need to be fully informed, both in writing and oral, the kind of care and treatment provided by Bright Star Care. They can refuse any and all treatment as they desire. They also have the right to confidentiality to both their health care and to their personal life. They have the right to have effective pain management, and we'll talk about changing condition, and increasing pain would be a change in condition. So we'll continue to talk about that through the onboarding process. And the clients have the right to voice concerns or complaints without fear of reprisal. A little bit about abuse. There is physical abuse, there's emotional abuse, and there is unreasonable confinement. Abuse can also be a form of neglect, and that client can be denied food, shelter, and medical care. And then there's the act of exploitation by someone in a trusted position that is exploiting that person by deception, intimidation, and forcing control over the person's personal assets, their funds, or personal property. And one last thing that I would like to just touch upon is cultural competency. And cultural competency encompasses gender, sexual orientation, socioeconomic status, faith, profession, taste, disability, age, as well as race and ethnicity. And we have to be sensitive to clients' reactions to impossible behavioral differences. So we care for a diverse client base, and we're proud of that, and we also employ a diverse staff. And so we embrace diversity and treat everyone with respect and dignity. Thank you.